Welcome to the Aesthetics Today podcast, the premier platform where we explore the ever-evolving landscape of aesthetic treatments, regenerative medicine, and cutting-edge beauty products and technology.
Welcome to the Aesthetics Today podcast, where we delve deeper into the ever-evolving world of beauty and medical aesthetics, bringing you the latest trends, insights, and expert opinions. I'm your host, Michelle, and today we're thrilled to have a very special guest on the show, Sarah Muthir, a distinguished pharmacist and advanced aesthetic injector, renowned for her innovative techniques and a holistic approach to beauty. Sarah is the visionary founder of Esthe Clinic, a trailblazer in the aesthetic industry, known for its cutting-edge treatments and bespoke patient care. Today's episode is proudly sponsored by Digital Aesthetics, a leading specialist beauty marketing agency dedicated to helping brands in the aesthetic space thrive and connect with their audience in meaningful ways. Stay tuned as we explore Sarah's journey in the aesthetic field, her philosophy on enhancing natural beauty, and her insights into the future of medical aesthetics. Whether you're a beauty enthusiast or a professional in the industry, this is an episode you don't want to miss. Let's dive in. Hi, Sarah.
Thank you so much for the lovely introduction.
It's very nice to have you on the podcast today. So we can get started with the first question then. Can you please elaborate on how Esthe Clinic's holistic approach sets it apart from other aesthetics clinics?
Okay, absolutely. My background, as you said, I'm a pharmacist and I decided to specialize in skin and aesthetics. We do a combination of treatments. It's not just aesthetics.
You mentioned infrared exercise therapy. Can you maybe tell us a bit more about that?
So we've got one of only 4 exercise therapy bikes in the UK, and we actually got this technology. It's a patented technology from Italy. And it's basically combining exercise, so it's sort of like a pedaling bike, with infrared therapy. So the combination of that helps in weight loss and skin tightening, in improving circulation.
So to me, it seems like an overall great treatment because it helps you sleep, it helps you feel better, weight management. So it's a great treatment overall.
Yeah. Weight and well-being.
And then the next question that I have for you is how does Esthe Clinic combine scientific methods with holistic principles to achieve optimal results for their clients?
That's a great question. So all the treatments we have are clinically proven, well-studied. We've got lots of papers to back them up. And I work with dermatologists who are, by the way, Brazil produces some of the best dermatologists and aesthetic practitioners. So we both together study and research treatments. We'll do our own sort of mini studies as well before we introduce treatments into the clinic. And it's great combining both, a pharmacist and a doctor. So both of our heads join together. And that way we can really figure out whether a treatment does work for a client or not. But since opening the clinic, we've reviewed a lot of our treatments. Things that don't work for us and our clients, we've stopped. And it will vary between clinic to clinic because your patient demographic will vary and patient outcomes will vary. So we constantly review our treatments and just make sure that they are as effective as we'd like them to be for our clients.
So based on your answer, all of the research that you do and the scientific methods and your background as a pharmacist make the treatments much more reliable for the clients because they know they are in informed hands and somebody that knows what they're doing.
Absolutely.
And then could you please share a success story where the holistic approach at Esthe Clinic made a significant difference in a client's treatment journey?
Oh, God, it's every week we get some of these. We have clients who have suffered from many, many skin conditions. I had a client, I think, who'd had severe rosacea for about 15 years and didn't know, but kept going back to the GP. They didn't know how to treat it. And within a week of us prescribing her one product, it just completely cleared off. And we get this, to be honest with you, day in, day out. I couldn't really specifically share one treatment. We get so much feedback about how easy it has been for clients to access treatments and how effective they are. And again, it's really down to combining two brains together, a doctor's and a pharmacist. And you think that this could be found in many places, but it's not the case, unfortunately. They're usually quite secluded. So pharmacy will always sort of be in the high street or in a hospital, and then doctors will be in their own practices, and they don't sort of meet head to head and sort of discuss these sort of treatments and share knowledge. So we, as pharmacists, know a lot about the products, about the drugs, how to deliver them, and doctors will know about the diagnosis and treatment of the conditions. But it's really good particularly with aesthetics. You really need to use the right ingredients and you need to deliver them correctly.
And the ease of access to treatment is really a nice point that you pointed out to me, because I know quite a few people that struggle with the same thing that the client struggles with, and it's an ongoing battle. So it's really nice to hear that your holistic approach has a very effective manner of treating this and solving the issues and overall enhancing their life because of this.
Absolutely. I know we had a lot of clients coming into us at the clinic saying that they couldn't get hold of their general practitioner to do blood tests. So we decided, you know what, let's start doing a blood testing service. And now we're working with one of the UK's biggest labs to provide that service.
So you offer a very all-encompassing service to your clients.
Precisely.
A one-stop shop.
Precisely. That's exactly how I set out to sort of open a clinic where pretty much there's something for everyone. I didn't want the client to leave without having a solution to their problem. You know what? Injectables, fillers, and Botox might not be the solution for some clients. So that's why we've got a varied range. We've got injectables, we've got the use of devices and energy-based treatments. And then we've got medical grade, so it could be prescription products. Got the blood testing service. So really varied range of treatments.
That's really nice to hear, because it isn't something that you find every day.
Yeah.
And then I would like to ask you, what specific skincare advice does Esthe Clinic offer to clients as a part of its holistic approach?
Right, there isn't specific skincare advice because everybody's skin is different. So we tailor the skincare according to the client, their concern, and their preferences. So sometimes it might be budget preferences. The best advice I can give somebody when it comes to skincare is to use good quality products, but particularly what we call cosmeceutical products. So we've got cosmetic skincare, which you can find pretty much in all shops. If you go into Boots or Superdrug or even Selfridges, you'll find cosmetic skincare everywhere. And then you've got the cosmeceutical products, which is usually products that you would find in skin clinics like Esthe Clinic. And then you've got your pharmaceutical products, which are prescription grade. And we reserve those mainly for really serious concerns. Whereas the cosmeceutical products are really active. They're designed to work a lot deeper in comparison to cosmetic skincare. So we stock some brands here. Some of my favorites include brands like Medicate, Zoe, Skin Health, and SkinCeuticals. And those are cosmeceutical products. So they're a lot more effective. Getting the right products is really important to have advice. It's not easy to select the right product for your skin. And because they're quite active, you might end up doing more damage than good if you're not using the right product.
You mentioned being aware about the client's budget, and that really stood out to me because skincare and aesthetic treatments can get really expensive. So this makes it very accessible to the general public as well, who might have skin concerns and need treatments as well.
Absolutely. So I decided in the clinic that when I wanted to stock products, I wanted the, more expensive stuff because it's quite effective. But not necessarily what expensive stuff is. But from the cosmeceutical range, we had something that, not everybody can afford, but they're sort of really high-end products. And then I've got the sort of the medium priced range, and then I've got the lower price range. So sometimes I have teenagers who come in with acne and they can't spend hundreds of pounds on skincare. So we've got, a lower budget, but still effective products.
Thank you. And then I would like to also ask you, the integration of the good pharmacist sounds very innovative to me. How does having an on-site pharmacy benefit Esthe Clinic's clients?
So the pharmacy itself is not my own, as in I'm not the owner of the pharmacy, but it's great having an on-site pharmacy because our clients, sometimes they'll walk in and they'll have a concern that can only be dealt with by using prescription grade products. So we've got doctors and prescribing pharmacists that can prescribe these products, and then we would supply them through that pharmacy. And because it's in-house, it's so convenient. The person doesn't have to then take that prescription and go find the product elsewhere at another pharmacy. They can just get it from the same, clinic / pharmacy. So I think it's just mainly for convenience for the client. Again, like a one-stop shop. They don't have to sit there looking around until they find their product.
That's really a nice thing to me, because sometimes when you can't get all of the products you need at the same place, you delay treatment as well. So
Yes.
Treatment can immediately start because they can immediately find it in the clinic as well.
Exactly. And it's just providing a complete treatment. I don't want to just do part of it and then tell them, okay, go find the rest elsewhere.
No, I totally agree with that. That's really a very innovative thought and way of doing business as well. Could you please explain how the partnership with the good pharmacist enhance the overall experience for your clients seeking aesthetic treatments?
Just the convenience, basically, that it's available. If they needed prescription grade products, not all clients will need it. But just the fact that it's on site, it's convenient. But of course, patients, if they want to take their prescription and go to another pharmacy, that's entirely up to them.
Good communication is really important in clinics, not only between the clients, but also between you and the pharmacist and the doctor, to ensure that everyone is receiving what they need and that everyone is happy.
Yeah, exactly. I think in the clinic, it's got such a family vibe. We don't really see ourselves as doctor, pharmacist, and whatever. We just all work really seamlessly together.
So there's a very good team spirit alongside everyone.
Yeah, absolutely. It's just one big family. It's a lot of fun to work here. We don't have that sort of hierarchy or anything like that.
And then what role does vitamin recommendations play in Esthe Clinic's approach to the holistic wellness?
Okay, so that's where my pharmacy brain comes in. So a lot of people don't realize that out there are many, many supplements that don't work. And I think actually there was a study in the US, in America, which said about 40% of the supplements that were on the shelves didn't actually have the ingredients that they claim to have. And not only that, a lot of them are poorly formulated. So a lot of people are taking these supplements, spending a lot of money on vitamins and minerals, and they're not really getting the benefit out of those. So my role at Esthe Clinic is just trying to help people understand what would be a great supplement for them, what sort of formulation, and just the fact that actually not everybody needs to take supplements all the time, all year round. Only if you have a specific need, and then you would go for a good quality one.
That is a really nice point that you made, because in today's age, social media is present everywhere, and a lot of people give recommendations about what people need to take, what they shouldn't take, and it isn't always an informed suggestion that they make.
Not at all. So again, we base our knowledge, I studied this in pharmacy, so and we know how to read studies and actually see whether they are effective studies on these products. Another thing we do at the clinic is bespoke vitamin infusions. So for people that need additional supplementation, we can actually give them supplements through the IV route and actually design the infusion so that it's bespoke according to their symptoms and to their needs. I see a lot of this. I'll go out and I'll see a lot of these, you'll see these stalls in shopping malls that are doing these IV drips. I don't know where you're based, but around here there are quite a few of these walk-in places that you can go get an IV drip. But all the vitamins are mixed into that bag, and it's a ready-made bag. It's been lying there for weeks or months, and what people don't realize is all the vitamins in there have already oxidized, and you're not really going to benefit. What you're going to benefit from is getting that hydration, so you feel it a little, better, but not necessarily getting the benefits of these minerals and vitamins in there.
I have one of those clinics right around the corner, actually. And they gave me a pamphlet in the week, and it's very generalized things that it treats. For example, a B12 infusion or a hangover infusion or focus. But as you said, everyone is different and not everything will work for everyone.
Exactly. So this is where I feel like actually people should just take supplements as and when, if they need to, according to their lifestyle, their diet, general health and well-being, and medical history. You don't need to be constantly taking supplements. You're just working your liver for no reason.
And then also, how does Esthe Clinic assess and address the unique needs and concerns of each client?
We always do a medical questionnaire, a medical consultation first. And again, most days, Lana, who's my dermatologist, and myself will do the consultations together. So people get to see us both and get to have both of our opinions. And most of the time, actually, we're of the same opinion. And just doing a full-on consultation, explaining what we think would be the best treatment for them, providing them, being quite open and transparent. So explaining to them any possible adverse effects, things that they need to do post-treatment or prior to the treatment. So we try to give as much advice as possible. And we also give them the option. We'll say to them, look, you don't have to do the treatment straight away. You can go away and research about it. I'm always writing down treatments that I've recommended and just tell them, go away and research about it. And then you can come back to me once you've made your mind up, if people are unsure.
It's really nice that you pointed out that two of you do the consultation. I think that puts quite a few people at ease as well, because it's like getting a second opinion while you're seeing some for one service.
Yeah, and that's why we do it. It's a second opinion, and it really helps ensure that we have actually recommended the right thing.
Can you please discuss a specific treatment or service at Esthe Clinic that embodies the intersection of science, holistic principles, and pharmaceutical care?
Everything embodies science and pharmaceutical care, because the products we use are all, pharmaceutical grade or clinically backed products. I don't think I can specify one treatment.
Let's rather say it like this, and can you pick one that is maybe your favorite?
Moment has to be polynucleotides. And I'm sure a lot of people are talking about those. But polynucleotides are basically fragments of DNA that are obtained from fish. There are some that are obtained from human cells as well. But basically, they're biostimulating. They stimulate once they're injected into the area that we're treating. They stimulate your skin cells, so you produce more collagen, more elastin. So they're great for so many concerns. We use it for acne scarring. We use it for pigmentation. We use it for lines and wrinkles. We use it for enlarged pores, for sagging skin, aging skin, all sorts. It's a really versatile treatment, and we see a lot of benefit from it, but it's also a very natural treatment. I'm not the type that sits there injecting lots of filler in my clients' faces. I like to reserve filler as a last-minute sort of tweak, just to enhance any work that we've done. But most of the time, I'll inject things like polynucleotides or skin boosters to just get the skin to work and do its job.
So from what I understand, you enjoy enhancing natural beauty.
Absolutely. I don't think we should be changing our face hugely and to the point where we're unrecognizable. And I find that a lot of people will start to look the same when they're doing filler treatments. I don't know. I mean, when I'm on social media, I'm always seeing these squarey jaws and the pointy chin and then the eyebrows that are all the way up here. And everybody starts to look the same. But I think each person is unique and we were created different, and we should just embrace that. But we can enhance our appearance slightly.
I think in today's social media age, it's really nice that you try to encourage self-love in a sense as well, because natural beauty is what you have naturally, obviously, and it's important that you love who you are.
Yeah, absolutely.
What steps does Esthe Clinic take to educate clients on the importance of maintaining overall skin health beyond aesthetic treatments?
I always say to people, there's no point in you guys doing any treatments at the clinic if you don't have a good skincare routine. It's the same as going to the dentist. If you don't brush your teeth every single day, at your 6-month checkup, your teeth are going to be awful and you're going to need work. So there's no point in not following a good routine. And it doesn't have to be a 10 to 12 product routine. It can be a very simplified but effective routine. And as long as you're maintaining your skin with that, then you can do a few tweaks in the clinic. But really, the main thing is your at-home skincare, because that's what you're going to be doing longer and more.
And based on this, I guess you can also suggest to clients a possible skincare routine that they can follow to enhance their skin and things like that.
Yeah, of course. And we really try to simplify things because I find that the longer the routine and the more complicated it gets, the less likely people are going to follow it. And we deal with a lot of professional women here and men, and they don't really have time for layers and layers of serums and God knows how many types of cleansers. So we try to simplify it. And anytime we introduce a new routine, we'll maybe give 2 or 3 products initially, and we'll say to them, go and use these products, see how your skin reacts to them. And if you're okay with those, then we can build your routine. Or if a concern changes. So our skin is never going to stay the same for the rest of our lives. In our 30s, we might need a little bit more anti-aging. In our 40s, we might start to see a bit of pigmentation. So our concerns change throughout time, and therefore your skincare routine will need to be adapted a few times.
So based on this, how often would you recommend people coming maybe in for consultation to adjust their skincare routine accordingly?
Whenever there's any sort of major changes, so we start to age from 25 onwards, maybe mid-20s, when we want to sort of introduce some slight anti-aging ingredients. And then possibly in your mid to late 30s, you want to do something that's a little bit more effective. 40s, and then during menopause, for instance, our skin will change. So if you had dry skin during menopause, you might end up with oily skin. And vice versa. Post-pregnancy is another time or during pregnancy, our skin will feel amazing, but then post-pregnancy, our hormones plummet and our skin will change. So it's really usually following some sort of event.
Thank you. That is very informative. As someone that's also very young still, a lot of anti-aging things are marketed to me, so this is very helpful. And I would also like to ask you, could you please share your insights into any ongoing research or developments at Esthe Clinic that align with its holistic and scientific ethos?
Okay. I mean, I actually went to a conference last week looking for new treatments that I could introduce in the clinic, because we're always up for introducing the innovative, the up-and-coming treatments. But actually, I didn't find anything new because we pretty much got it at the clinic. So one big innovative treatment. But since then, I haven't really found anything that exceptional that we'd need to introduce.
Earlier in the interview, you mentioned infrared exercise therapy, and that to me personally stands out because not a lot of clinics offer that.
We got the infrared exercise therapy a few years ago when I first opened the clinic, actually. So it's not new to us. Technology is introduced quite slowly, and people don't, not necessarily people, but there isn't much information out there about these new treatments.
How does Esthe Clinic ensure that its treatments and services remain up to date with the latest advancements in both aesthetics and pharmaceuticals? I know you mentioned the conference that you attended, but is there anything else that you do as well?
Constant research. So Dr. Lana and I are constantly reading research papers, and we get those usually online or through journals. And then, attending conferences. But we're both professionals, so we'll both do continuing professional development. And it's just, constant reading. That's all it is, honestly. And trialing, lots of trialing products. So we'll try a device or a product and we'll realize, okay, this isn't the right thing for our client. Anytime I introduce anything at the clinic, I personally try it, and I'll get Dr. Lana to also personally try it, because I don't want to be introducing a torture device for people. If you want to look good, you don't have to be doing really invasive treatments that will be very uncomfortable. So we always have to try things.
It's very comforting to know that you also try the treatments and you actually know what it feels like. what is happening, the aftercare, things like that. That's very comforting to know.
And part of the consultation process as well, because if I know how it feels like, I can explain it better to the client and explain to them what they should be expecting.
And then I have a few questions that are just a bit of fun questions that I want to ask you as well. What is the most embarrassing or funny moment that you've experienced in your career?
In my career, I don't. Oh God, I have no idea. I don't think I've had like something so embarrassing, or maybe I'm going to think about this when I've logged off this call.
I understand we usually block out the embarrassing moments to protect ourselves.
I don't think I've had like some seriously embarrassing moments. I mean, I like to laugh at myself. I'm kind of like the clinic clown. We like to have a lot of fun and we joke around. But with regards to like embarrassing, no. I think other people have embarrassed themselves in front of me, not the other way around, thank God.
You are very lucky to not have experienced that as yet.
Yeah, thank God. But I don't know, maybe in the future.
And then reflecting on your journey with Esthe Clinic, what was the toughest hurdle you had to overcome and how did you tackle that?
The toughest was actually finding the right team. That was honestly the most stressful thing to deal with ever. I mean, we opened the clinic just after COVID lockdown was lifted in the UK. And I just struggled to find people that actually wanted to work in clinic. A lot of people obviously were used to working from home, didn't want to do, certain hours, didn't want to do weekends, didn't want to do certain treatments, or they just didn't really deal with the client as well as I'd want them to. So I went through a good couple of people until I found the right team.
Especially after COVID, I understand what you mean when saying it was difficult to find people because it changed the entire world. So people that want to work from home and so on, I think people still had to adjust to the reality of going back to in-person work as well.
Precisely, yeah. But yeah, that was honestly my biggest struggle. And I thought, oh my God, I'm never going to be able to run this place. But somehow it worked out.
That's very good to hear. And here you are today, successful.
Hopefully, yeah.
Balancing a successful career and personal life can be very challenging. What strategies do you use to maintain a healthy work-life balance?
I don't. So I have two boys, but I mean, I see them quite late in the evening, but they're okay. So it is a struggle because I work 6 days a week. I actually have two jobs. So I'm not just a clinic owner. I also work as a pharmacy inspector, which takes up a lot of my time as well. But I think it's just spending quality time when I'm at home with the boys, making sure that I have the Sunday just to them. And they seem to be thriving, so it hasn't affected them. I want them to see that you should be hard work. And if they see me working really hard, hopefully they'll be like that too.
You're being a great role model for them. And you say you work 6 days a week, but you still prioritize your family when you have the time. So to me, that's a work-life balance.
Yeah, of course. Yeah, like a lot of people don't. I don't really do a lot of socializing, for instance, outside of work, because I'm either at work or I'm with my boys. So people sort of struggle to believe that I'm not a sort of an out. I don't go out a lot. I just like to go home to my boys as soon as I've done my work.
If you could give just one golden piece of skincare advice to everyone listening, what would it be?
Oh God, I have so many. Get a skincare consultation, honestly, because then hopefully if you've gone to the right person, you'll get the right advice. But if I was going to recommend, if it's product-wise, I would say retinol is one of the best ingredients out there. Just use it correctly.
And based on that, can you maybe give an example of how to correctly use it or an incorrect way to use it? I know it differs according to skin as well because,
Yeah, so retinol is an anti-aging ingredient, but it's great for acne, it's great for pigmentation, it's great for enlarged pores. I like things that are great for lots of things. You would introduce it very slowly into your skincare routine, and you don't need to start using it until you're in your sort of mid to late 20s. But you would use it initially, let's say, once or twice a week for the first 2 weeks. And then after that, you'd use it every other night, and then for about 2 weeks, and then start using it every night. What I find is when people use retinol, they'll start using it every night straight away, and then they'll get excessive dryness, excessive shedding, red skin, and they'll think that they've reacted to the retinol. It's because they've just overused it in such a short space of time, and they haven't sort of integrated it slowly.
Okay, thank you for that. That's very helpful, actually. And then how do you manage to maintain professionalism on social media while also showcasing the human side of your clinic and staff?
It's really difficult, actually. I find that on social media, people are quite unforgiving. So when I do a video, I'll just sort of hang on to it for a little bit before I post it out, because then the next day I'll go back and I'll be like, no, I didn't say this correctly, or no, somebody's going to misjudge that or misunderstand that. And a lot of the times I'll explain something and I'll have the same sort of questions about how do you do this? And I'm like, but I explained it in the video. So you just have to be polite and understand that not everybody will get it straight away. So that's it. I mean, I used to get upset if somebody commented something mean or anything, but now I don't.
It's nice that you reflect on a video again before posting it, because that ensures that there isn't any lashback unnecessary as well. And that's a very nice touch. I like that as well.
Yeah.
And then finally, the last question is, what aspect of your work at Esthe Clinic brings you the most joy or satisfaction?
Just when my client comes back and says they're so happy with the results, or they're so happy with the treatment that we've done. And yeah, just working with my team. It's so much fun. It doesn't feel like work.
I'm glad to hear that, because you never work a day in your life if you really enjoy it.
Yeah, exactly. It's precisely what I wanted to, when I opened the clinic, I wanted a job which didn't feel like, something that I had to really struggle to get out of bed for in the morning. And yeah, this doesn't feel like work. It's like doing your hobby every single day.
And then just a follow-up on that as a final thing, how did you just decide to go into aesthetics from being a pharmacist? How did that transition take place for you?
I was on maternity leave and I got bored because I'm just such a workaholic, and my baby was tiny, and I thought, no, I need to do something. So then I looked at aesthetic courses, and I was like, okay, I'm going to do that. And I just went into it. And then actually opening up the clinic was completely by chance. I had walked into the barber next door to get my son's haircut, and he was telling me that he wanted to get rid of the shop next door. And I was like, I'll take it. And that's how it happened. And Esthe Clinic opened up.
I really want to thank you for your time today, Sarah. It was really enlightening. And Esthe Clinic really sounds like a wonderful clinic that's a one-stop shop and really takes care of their clients.
It is. I'm not being biased.